who is a dynamic and a seasoned professional with 15 years of experience as a medical advisor. She has got in-depth research proficiency, and she has also formally been associated with the Department of Ayurvedic Medicine. She's an Ayurvedic specialist associated past with the Podar Ayurveda Hospital in Mumbai in India. She is a profound researcher with one research work titled Controlled Clinical Study on Management of Bronchial Asthma using polyherbal formulation, which was being accepted by a renowned university in India. Welcome, Dr. Komal. And without much wasting time, now I would like to
To Dr. Indu that I, as a doctor who sees adults mostly, have very clearly seen that we are seeing a lot of cough, which is more troublesome, as I said. So, Dr. Indu, what has been your experience in the last so many years, 10, 20 years? Do you think cough is increasing? Do you think it is becoming more difficult to manage? And what do you think are the reasons for that?
Yeah, I completely agree with you. In fact, it has become a distressing part of practice today. And you can imagine if children are coughing, how distressed parents are for the variety of reasons, quality of life, night sleep, their work hours, children's school absenteeism. So all is becoming a problem. The reasons I think are first of all is increased viral infections. Increased number of viral infections. Children are going to school early. They are in closed AC environments where they transmit infection to each other. We are also having an environment which is triggering a lot of cough in most kids. So the pollution that we are seeing, the dust particles that we are seeing in the environment, which are adding to the trigger. So we are increasing number of allergies. So more the number of allergies that we are seeing in children, they are causing lot of cough, allergic rhinitis, rhinoconjunctivitis. So these are the two main reasons I would think: viral infections and an increase of allergies, increase in the incidence of asthma. That also we are seeing. We as pediatricians don't see so much of reflux disease as you see as adults. But having said that, it is also on the rise in pediatrics.
Yeah.
So this is, I think, a large gamut of patients that we are seeing.
Thank you. Thank you so much for very clearly telling about the pediatric aspect of this. And there is also an associated social angle to this, that nowadays most families are nuclear families. If the child is coughing at night, the parents can't sleep. Otherwise somebody or the other is there to look after the child also. And then these parents also get very distressed, very edgy. They pester the doctor, kuch to karo, give some kind of cough syrup, all of that is there. And as Dr. Indu was mentioning, some of the cough syrups are not to be given. So it's not an easy situation. Yeah, I don't envy the pediatricians too much. Coming to Dr. Komal. So Dr. Komal, Ayurveda is an ancient science, and you are an expert in that. And I myself am interested in these sciences also and know a little bit about it. But how does Ayurveda look at cough? Is it a symptom? Is it something to do with the patient? Is it a disease? And how does Ayurveda look at the management of cough?
Yes. Yes, please. So in Ayurveda, cough is described as a distinct disease entity, and with its different types of coughs, the types are classified in the classical text of Ayurveda. And based on that, the pathology of doshas, which we describe in Ayurveda, there are three principles mentioned in Ayurveda for the cough management. First, it's focused on the detoxification therapy. We call it as the Panchakarma therapy, where we remove that dosh. The second is the pacification therapy, where we use the medicinal herbs, the polyherb formulations, like your holy basil, your curcuma longa, your zingiber officinalis. These all multiple herbal formulations proven to have an anti-inflammatory, soothing effect, expectorant actions. And the third important part Ayurveda mentioned, as you both have highlighted, sir, that nowadays the cough is very common because of the environment, because of the general poor health of the patient. So some of the herbs, we call them as a rejuvenatives or rasayana therapy, like your aloe vera or zingiber, your ginger, they all improve the immunity and the capacity of the lungs. So that's another third part, which is the regenerative medicines which are there in Ayurveda. So based on these three principles, we treat cough in the Ayurvedic treatment.
Thank you. Thank you, Dr. Komal. So coming again back to Dr. Indu, now addressing the elephant in the room, which is children have a lot of viral infections. When they have a respiratory infection, we know as a doctor, we know that 90% of the time it's a viral. However, by the time the patient leaves our chamber, 90% of the time he's carrying a prescription of antibiotics for one reason or the other. So how do you convince the parents? And second part of the question is, clearly say 2, 3 situations where antibiotics are genuinely necessary. Tell us, please.
So I think the second is easier because it's a shorter list. Okay. So if I have a younger child, an infant with otitis media who started with a cold cough and then it went into the ear, and if it's an infant, not a child below above age of 1 year, where we can still manage with painkillers, I would give an antibiotic. If I have a child with sinusitis, I would definitely give an antibiotic. And if I have a child with a lower respiratory infection, which is like a wet cough, like the case I described, I would definitely give an antibiotic. So if wherever I feel there is a secondary infection setting in short, I would give an antibiotic. Then you have certain pathogenic causes of cough which are bacterial in origin. Say, for instance, a diphtheria, but there you would definitely need an antibiotic. Or, for instance, a tonsillopharyngitis. There you would definitely need a group beta hemolytic streptococcus causing it, and you will need an antibiotic. So these are a few conditions where the clinical features are very clear. You are not going to mince words to say find out whether you need or not. Now, if I have a child who has cough and in the family there are other sick members, or if I have a child who has got a rhinorrhea, or if I have a child who has a conjunctivitis and a rash, okay, these are all hallmarks, or even a diarrhea, for instance, or for matter. Then these are all hallmarks to tell me that these are viral. Convince a parent is a task because they come with a gun on your shoulder to say, "Kal mera exam hai, परसों हमको घूमने को जाना है," and all that just goes on. But I definitely spend 5 minutes extra with such patients. And I tell them, if you have a sick contact at home and 3 of you are sick, it has to be viral. I explain to them what are the indications where you should use an antibiotic. I explain to them if I misuse an antibiotic, how inappropriate it would be for your child. So when I spend that much time, many patients do listen. And some patients say, "Likh do, hum nahi denge." So when I just judge that patient, वो सच्ची में नहीं देगा तो मैं कभी-कभी लिख भी देती हूँ. And I've seen when I write and give, they don't give because they
Yeah.
have something like, they want some safety net. So that's how it is.
Yeah.
So
Thank you. Thank you. So I also see a little bit of an ironical thing here that allergic patients, since I see a lot of allergies, allergic patients have cough for a variety of reasons, mostly allergic. So when they cough with cough, it's not necessary that they have an infection even. What to say of a bacterial infection? Secondly, the second irony is that antibiotics giving unnecessarily are bad for everybody. But for atopic individuals, it's even worse. It drives their atopy in the wrong direction. So here it's a double trouble for them, and you have to be very, very careful. So I'll stay with you, Dr. Indu, for a bit. And so you also see a lot of, kids coming with coughing only, and actually it turns out to be asthma. So here there are two difficulties. One, you yourself are not very, very sure immediately. You need a certain amount of time to observe the child, whether it is asthma or not. Secondly, to establish the diagnosis of asthma in children is difficult. Convincing the parent, it is difficult. So sometimes we beat about the bush and say, it's allergy, it is eosinophilia, it's allergic bronchitis. How do you point blank, when you are convinced in your mind that this is asthma, do you point blank say, or do you break it little slowly? How do you deal with this?
if you don't call a spade, you will not be able to convince the patient to even do the treatment for it. Having said that, I try to judge the patient. Okay, so here we have to be a little bit of a mind reader. There are some people who will not listen to you and they would go to the next doctor. I'm not worried because they would go to my colleague there. I'm happy they go to my good colleagues. But there are some people who will not get convinced easily. So there, though I will tell them everything, I will counsel them, I leave the decision to them. Okay, so sometimes when you do this and you don't enforce something on them, the next time the child wheezes, then they remember what you said last time, and it's easier to convince them. Sometimes I use an angle of another patient who may be waiting in my waiting room, who's on inhalers and who's doing good. I call them and I have to make them talk to them. That patient sometimes can convince better than I can. So it happens like this, right? And but I will definitely make it a point, call a spade when I'm convinced myself. Invariably, as you rightly pointed out, by the time the patient has come and we have come to a conclusion that this could be allergy or asthma, the patient has already come to you 2, 3, 4 times. Already they are grumbling to say, doctor, again, so then I kind of piggyback on that and say, see, you already come 3 times. And today I say, okay, you put your symptoms in ChatGPT and see what ChatGPT tells you.
Mhm.
That convinces them.
Yeah, yeah.
So these are simple tricks that we use.
Yeah, exactly my thoughts. Exactly my thoughts also on the same subject. And I sometimes say that, explain to them that, look, your child is clearly having allergy, that they understand and accept. Allergy is happening in the air tubes, it's called. So it becomes a descriptor of allergic bronchitis. Allergic bronchitis with this is called asthma. It's the one and the same thing. It's like telling a diabetes. One way is you say it is diabetes. One way is you say you have low insulin and high sugar. Which do you think is the correct way of explaining? Most patients say, obviously, diabetes. Why are you beating about the bush saying insulin is less and sugar is more? So they do understand. Thank you. Now, Dr. Komal, so you are a Ayurvedic physician and a patient has come to you with cough, you're giving some treatment. What goes in your mind that this problem is a benign problem and is I am okay treating it with Ayurveda? And what are the red flags that you say there is a strong possibility or there is some possibility something serious is going on and you would like to immediately refer somebody? So what are those red flags for you?
Yeah, sure. So, the signs are mentioned in our classical text, like if a person comes with a cough, but with a weight loss or a breathlessness, having a prolonged duration of cough or a foul smell in the cough, with some systemic features or blood coming from his cough. So these are some signs which we mentioned as a shared and which highlights us. Now we need to refer this patient to a specialist, to a chest physicians. These are the red flags we always see Ayurvedic practitioners in situations.
Yeah. So blood coming out, weight loss, child looking or the patient looking very sickly, chest pain, shortness of breath, no response to treatment. And these are the things. And doctors generally have very strong antennas that they can judge that there is something else going on. Also, I would like to say here that the little bit fear in the mind of the patient and the family is that could it be lung cancer? Now, only cough and the reason is lung cancer is extremely rare. So just for that, there is no real reason to do a CT scan or something. But so just keep that in mind also. So staying with you, Dr. Komal, explain to us a few and to our audience some simple home remedies for cough because they do work sometimes better than our cough syrups. Shahad, mulati, kantkari, pipli, these are things, these things work. So please tell our audience a little bit more.
Yeah, so in Ayurveda, there are some simple household remedies like you mentioned turmeric, curcuma longa. So that turmeric powder, we mixed it with the hot milk, and that hot milk, turmeric hot milk, which is very useful. It's proven to have anti-inflammatory, anti-soothing, antibacterial action. So turmeric milk. Second thing, we uses different types like black pepper or mulethi, that is glyceria as a glyba powder, and we mixed it with honey. So honey is mentioned as a very important ingredient in this cough scenario. So we mix this powder, black pepper or mulethi with the honey and use this 3-4 times 1 teaspoon in such medicines. Then, sir, the holy basil like tulsi, our ginger, we make its decoction, or we take the juice of it and use it as a herbal remedy for these things. And black pepper is also very useful, sunthi or ginger. So these are some herbal medicines which we commonly use as a in Ayurvedic cup, especially these allergic cups and viral cups. It's very useful and proven to be effective.
Yeah, yeah. So we are almost running out of time. So let's very quickly take something. So very quickly, Dr. Indu, acute cases of cough, do you investigate or you just leave it? And if you decide to investigate,
No, I don't.
You don't. Wonderful, wonderful.
Sorry.
So wonderful that, the doctor has to be confident that this is clearly a viral. And as Dr. Indu was just saying, so many members of the family are having the same symptoms. It's clearly a viral. Then why are you unnecessarily doing things? Nowadays, there's also a fashion of doing, PCR tests and biofilm, those things, where it's so expensive and they try to find the name of the virus. What difference does it make to your treatment, whether it's influenza or para-influenza or even COVID for that matter? So don't waste money on these things and time on these things. Wonderful. Now, just in one minute, I will request first Dr. Indu and then Dr. Komal to please give our doctor audience here 2 golden tips to how to approach cough and manage cough nicely in the clinic. Dr. Indu, please.
Just thinking what golden tips. The first thing is don't panic. Don't panic. It's only a cough. It is a body protective mechanism to ward off something which is, which the body is trying to protect itself in whichever way. Okay. Secondly, so only if it is recurrent, persistent, and it has the qualifying features which I mentioned, that's the time you need to worry. Okay. So mild coughs. In fact, in COVID, I would like to just take 1 minute of yours, not even 1 minute, 30 seconds. So in COVID, we had the lockdown and children were home. They did not get their 5 to 6 respiratory infections in a year, which they're supposed to get.
Yeah.
Post everything opening up, we had an onslaught of children with such bad viral infections and cough. So please, parents, don't worry. 5 to 8 of infections in a year is normal. Don't overreact to the cough. Okay? If you overreact, children get affected very too much because parents get affected, children get affected. We are seeing a lot of psychological cough. It is a diagnosis of after I have excluded everything else, but it is a big diagnosis today. So that's another message that I would like to give.
All right. Thank you very much.
To my doctor friends out there, I want to give only one message. Please look at the upper airway. Every cough does not come from the lungs. Please look at the tonsils, adenoids, the sinuses. Sometimes just a postnasal drip and the upper airway cough syndrome. Do not neglect the upper airway.
Yeah. So Dr. Komal, one golden tip from your side.
Yeah. So, sir, as you both have highlighted that cough is nowadays very, very common, and the use of antibiotics or use of antibiotics is common. So avoid that. First, we need to use the simple herbal homemade remedies. Like if you have a cough, have the hot water or the turmeric milk or your honey, black pepper. So first try that. Second part is that improve your immunity with these polyherbal formulations. The use of antibiotics in such viral disease is not actually required, which will cause resistance as you highlighted. So these polyherbal combinations which are very safe, which contains this Ayurvedic herbal medicines and clinically proven, like this ginger, your aloe vera, black pepper, they are available in India and worldwide, and you can use it safely in all patients. So use of this polyherbal formulations. And third part, sir, is in Ayurveda also it's mentioned that yoga therapy like pranayam and all, so which will helps to improve the lung capacity. And it has proven, we all know, sir, that nowadays it has proven it's giving you the immune power, the preventive thing. So every person at least for some time need to do this pranayama and whatever yoga therapy which is mentioned in our ancient Indian texts. So these are 3 tips I would like to tell to our audience.
Thank you very much. Now we are going on to so by the thumbs up, Dr. Indu was also saying that don't give allopathic medicines initially, try the home remedies. This is very true. Expectorants, for example, we know that steam and drinking plenty of water works equally, if not better, right? And these herbal things, which I just mentioned, honey and other things, kadha and all that, they work very well. They work beautifully. So we doctors should shed our resistance that this is my subject and that's whatever helps the patient, wherever you can get help, one should take that help. And with a lot of gratitude. So there are some questions. Now let's go on to the questions from the audience.